Thank you for understanding that I'm values first, nutrient deficiencies second,
Yeah.
health goals third. Honestly, it's hard to define even that order, but if something goes against your being and your values, how would you comply?
Exactly. The stress that you would experience eating meat would do more damage than to your nutritional status.
It
Than
has been like that. Hello and welcome to the Fusionary Health Podcast. You are in store for such a special episode today. I have a special guest. Her name is Dr. Sandra Scheinbaum, and she trains people to become functional medicine health coaches. She helps practitioners and businesses hire them because she believes that health coaches are the key to combating chronic disease and reducing healthcare costs. As founder and CEO of the Functional Medicine Coaching Academy, Sandra is a leader in the field of health coaching education. And she's an educator, a clinical psychologist, an author, and a public speaker for nearly 50 years. She founded FMCA at age 65 because rather than retiring, she's on a mission to grow the health coaching profession so that millions of people can get the support they need to lead healthier lives. Her latest book, Your Health Coach Will See You Now, Creating a Healthier Future Together, advocates for health coaching as a critical component of primary care. The greatest joy in her life is being a grandma to twin toddlers as well. So thank you. Thank you for being here, Sandra.
Well, thank you for that kind introduction, and I'm so excited to be here.
So my first question to kick us off is, what led you to creating FMCA? Is there a story around your own health or health journey of different people in your lives? What led you to creating an organization like this at age 65? Like, that's called living your mission all the way till the end. I love that.
Well, that was 10 years ago. And so my career had many twists and turns. I started out in education. I was teaching special education. I had a classroom for 5 years, and then I went on to teach teachers how to become special education teachers. Now we call these kids neurodivergent thinkers, for example, and the name's always changing, but their needs are not. They're the same. And way back, we're talking in the early 70s, I started to lead workshops for other teachers. I was noticing that they were really stressed and burnt out. And so I was doing stress management for teachers. I had parents groups, the kids that I was working with. I got the parents to come together and I was leading groups for them, stress management for parents, for kids, teaching breathing techniques. And these were the days way before mind-body medicine was officially a thing. We didn't have breath work then. It was just teaching breathing techniques. And I just always had this sense that the mind and body are one, and we can create tremendous change by changing mindset, for example. And so I saw the need in clinical psychology for changes. I got a doctorate in that field. But again, I was looking at people in that profession who came with that orientation that you're broken and you need to be fixed. And I wanted to go in the opposite direction. No, what's strong with you? What's right with you? And using the strengths perspective. So I spent many, many years as a health psychologist. And what I was really doing was health coaching, but I didn't realize it because there wasn't a profession like that at the time. We're talking about 80s and in the 90s. And I was always very interested in nutrition, mainly because I was interested personally. And I had really bad eating habits, as so many of us do in our 20s, early 30s, and saw the remarkable improvement when I would change what I was eating. And I had many people who were coming to me when I was practicing as a health psychologist, I did a lot of workshops in the community, and people would come up to me and they'd say, I'm a health coach, but I don't really know what I'm doing. I would like to learn what you are advocating. And so that was what inspired me to create a program. And initially, it was just going to be very small, local, in the Chicago area, training a few people in the modalities that I had specialized in, which was integrating these principles of mind-body medicine, positive psychology, psychology of eating. And along the way, I'd also trained in functional medicine. And so putting that together and teaching health coaches to go out and really use these principles to coach effectively. And that then led to a decision to play on a bigger stage. And so I went to the Institute for Functional Medicine, and they had always wanted to have a health coach program, IFM, and the white people hadn't come along. So they said, well, let's give it a chance. We'll do this. And so that was 10 years ago. And we have now trained over 5,000 people. And I have really seen firsthand the benefits of health coaching. We have so many stories of how lives have been changed. Chronic disease, 90%, as you know, are basically driven by lifestyle choices. And when people have a guide, support, ally, they start to make habit changes. And this will dramatically lower healthcare costs. So this has become now my mission, to really speak on many stages, to influence as many people as possible, to try health coaching, to become a health coach, practitioners to work with a health coach. I know you do, and see how critical it is to support people in this way.
Absolutely. I love that you shared that. I mean, it's quite a journey that you've been on to evolve, to get to share and teach what you share now. And so many of us in the health and wellness profession had those kind of winding roads that led us to where we are now. I met a friend years ago who said, it's so funny. All you talk about is turmeric, but nobody has any idea that you've been obsessed with health and Ayurveda for over 20 years. Yeah. This is just the current way you love to say, please win. And you actually have a million others because you've been doing this forever and you're just trying to keep giving us tools. And I'm like, yes, you are right. Thank you for seeing that. It's been a long, windy road. So my next question is, I see on the back of your book here, it says, is your doctor too busy to really care for your health? And I think that's such a profound question, especially in this moment. In this moment, I'm seeing so many doctors, a few in particular on Instagram, who are sharing their struggles with health insurance, their struggles with coverage, their struggles with being valued for what they do. And I've shared on here, I'm married into a pretty big doctor family in South Florida. And so I have a front row view into the level of overhead, staff, billing to fight with insurance that it takes just to be a doctor. And then we talk about patient care, which is what they studied to do and what they want to do and what they really lovingly pour into. But then they're almost kind of harassed because they have the staff that constantly needs management and all that. So when we talk about, is your doctor too busy? I think nowadays, because of the construct of Western medicine with insurance, oftentimes the doctor is too busy. They have a lot of forces pushing at them to see us in what we now know is like the 7-minute window, 5-7 minutes that they have for us. Sometimes they don't have the time, I think, to deal with the complexity of us as a patient. So years ago, I switched to functional medicine because I knew without a doubt there's just no way you can manage a person like me who I come in with lists of questions. And I remember primary care being like, you are fine. You are so young. You're fine. Everything you just asked, you're fine. And I thought, you are not my person if that's your answer. I need support. And we have talked about this from functional medicine with health coaching and the power of it. So will you speak into that for the audience today? Because I think a lot of people are struggling and they wish that their doctor covered by insurance was enough, but they might not be getting in the answers that they need. And they might also not understand the power of the health coach as the adjunct support on the journey.
Yeah. So first of all, doctors for the most part are well-meaning. and caring. They went to medical school to serve, to save lives, and they have so many forces against them. And I want to share what I remember, and I talk about this a lot in the book, and that is the community family doctor. In my husband's case, I want to share that example. His name was Doc Nimes. That's what they called him, Doc Nimes. And he saw my husband, his sister, every other family member, his neighbors on the block. And so this doctor knew your name, made eye contact. They knew your family history. They knew your dog's name. They were invited to a special, he was at our wedding. Now what they lacked, certainly they lacked in advanced technology. This we're talking about the 1950s era of medicine, but it was relationship built. And they had what we used to call bedside manner, which has been evaluated as being the most critical factor. What is that? That is really looking somebody straight at them, making eye contact, conveying hope, empathy, listening to a patient. And that is something that is critical to healing. When you have that in a doctor, that therapeutic alliance. But there's so many forces working against that. There is the fact that there's so much so-called paperwork. It's not paperwork, it's computer, but so many things that they have to document. There's also administrative constraints. This is big business. So you have these conglomerates, and they've bought up primary care practices. Amazon, has this is a network of practices where they have 300, 400, 500 physicians, even more. The hospital systems also are now running the practices. So you get these rules passed down. Well, you have to see so many patients in a day, in a week. You only have 7 minutes. What is that impact? Well, let's say you are a patient, you're coming to see that doctor. You tend to then see that person as the authority figure. They only have time to just refill your prescriptions and one main complaint. But perhaps you have other things that you want to bring up. And either you run out of time, or maybe even if that doctor is asking you about your diet or stress in your life, you may think, oh, he's got a waiting room full of patients. I don't want to be, a complainer. I don't want to take up more of his time. He seems rushed. And so you leave with these questions unanswered. There was a recent study in the UK that it was a survey, and it showed that 9 out of 10 women feel unheard by their doctor. Wow. And that their concerns are not being met. Enter the health coach. So I want to be really clear. The health coach is not replacing the doctor. They don't diagnose. They don't have a medical license. They don't develop a treatment plan. They listen to you. They are the experts in bedside manner. They take the time when you feel like this person, you can tell them anything. And they support you to make the kind of lifestyle changes that are so critical, because we know 90%, of chronic disease conditions are brought on or exacerbated by lifestyle. And what the number one reason that health coaching is so important is they help people take charge of their health. Study after study has shown it builds self-efficacy, the sense that, I can take control. I can be the CEO of my health. That is really critical. It's a recognition that genes are not your destiny, that just because it runs in your family doesn't mean you're going to get it. Like you're walking down the street, you suddenly get rheumatoid arthritis, but you can make these lifestyle changes that are so critical. So that is why it is so important. And it helps burnout for the doctors. They love it. And you can certainly talk about that, where you don't have to give the same lecture, that you can hand things off to your health coach. So that's why I want to see a health coach on every primary care team.
I think that would be brilliant. Talk about the greatest solution to healthcare right now is add a health coach into every practice. I'm curious, what practices do you think are best supported by functional medicine health coaching?
Yeah. I think if we start with primary care, that's your internal medicine, your family doctors, your OBGYNs, your pediatricians, that's the first line. I just heard today someone said, I think we need to reverse engineer. I think health coaching should be first line, paid for by insurance, and then you pay out of pocket if you need the specialist and you need the doctor for something. But the way it works now, and something that I think is bears just talking about, is this critical shortage. So we're talking about somebody getting 5 minutes, 10 minutes with a doctor. Well, that could be good because so many people are now unable to find a new doctor. Maybe their doctor's retiring, and that's a thing. Doctors are retiring from primary care, older doctors in droves. We're anticipating by 2030 a shortage by 124,000 of primary care doctors because as older docs retire, new people entering medical school, residency, they're not choosing primary care. They're saying, hey, I don't want this job. I want to be a dermatologist. Yeah. I want to be at orthopedics. I'm going into orthopedic surgery, for example. And many doctors are also, I talked to someone, she retired from her practice, a very busy OBGYN, burnt out. She became a hospitalist. So she loves it. She just goes into the hospital. She has defined hours. She's not on call. She knows, okay, from this hours, a few days a week, I'm going to go in and deliver some babies, and then I'm done. So where does that leave somebody who wants to really have a relationship with their doctor? I was at a baby shower this past weekend, and they were talking about getting your doctor, in labor and delivery. And they said, have no expectations that the doctor that saw you for your visits during your pregnancy, they're not going to deliver your baby. It'll be a total stranger. Well, I didn't have that in the 80s. I had one doctor. They were there for delivery, and that was the assumption, unless they were sick or on vacation. But otherwise, it was them. But that's not the way it is today. In fact, most young people they just go to urgent care for everything. Wow. That's not going to help you if you have chronic conditions.
Correct. There's so many things you said there. One thing of interest, a few things. One, it's interesting that we're going to have a shortage of internists, not functional medicine, but primary care docs, because in some ways it's like the least sexy at this point of the professions. When I see youth, who I meet a lot of them in my family, who are thinking about medicine, they're like, I want to do ortho, I want to do neuro. Surgery is more appealing, and anyone who's in medicine right now will say surgery gets paid better. So if you want to be reimbursed for this massive loan you're about to take in your life, you might need to pick a profession in which you'll get to pay that off. So I can see why that shortage will happen. Also, it's a tough job. I mean, the level of chronic disease we're talking about that gets to primary care, because I work with many primary care offices that recommend my turmeric, and you've got a high volume practice. But when someone comes in, like we're talking about, it could be like 12 issues. Yes. And there's not enough time in the appointment to deal with all of it. My question around which type of practice could take health coaching, I thought you would say all of them. Because if we go to the endocrinologist, we could use a health coach. If I went to labor, my OBGYN,
that's right,
I could have used a health coach through pregnancy.
That's right.
That would have been real helpful. I had to do my own research, and I wrote a whole book on it. So I was like, you guys aren't helping me enough. I'm going to go figure this one out myself and put it together for others. Really every subspecialty.
Yeah. Yes.
When we go to ortho, many times when I went to ortho post-children and I had plantar fasciitis, the answer was, you need to lose 20 pounds. Mm-hmm. And I looked at the ortho and I was like, do you say that to everybody? They're like, pretty much, that's why your joints hurt. So I said, you need a health coach then. How are you going to support us in our weight loss if we finally came to you and that's your answer?
Yeah, even surgeons. There are studies that show that those people who have a health coach, both pre-surgery, post-surgery, outcomes are better, less pain, less hospital stay. That's been shown. Rheumatologists, for example. And one of the areas that health coaches can focus on, functional medicine health coaches in particular, is toxic load and the impact of toxic load. Also neurologists. There's Dr. Dale Bredesen is somebody that he was doing great work in reversing Alzheimer's disease. And many of our graduates, they're health coaches, they take advanced training in reversing cognitive decline. And they are helping people, they're on the front lines, helping people to really avoid Alzheimer's, reverse early stage Alzheimer's. And it's remarkably effective. So absolutely. There is no field that could not benefit from a health coach. And I want to be really clear that we have the best care for trauma. So if you think you're having a heart attack, you don't go to get a health coach. You go to a trauma center and you get the best treatment available if that's what you need. But what happens when you're discharged? That's where the system falls apart, because nobody is addressing lifestyle. I know that personally. My husband, about a year ago, had vascular surgery, had a huge blockage. And so I was in those consultations where they go over, post-surgery and nothing, and even the intake as well. And I said, well, don't you want to know about what he eats and the fact that he's not actually, no, I mean, it wasn't even on their questionnaire. Like it didn't come up, or stress or sleep. None of that was addressed.
Isn't that insane? Yeah. I remember years ago, I took a sister-in-law of mine to a endocrinologist. She needed one. And I went to the appointment. They're like, okay, well, just so you know, you're borderline Hashimoto's. You're not there yet. Just pay attention to how you feel. You'll be there in about 6 months and we'll start treating you then. And I went to the doctor. I was like, question, do you think she can change anything in her diet to reverse the path she's on? The doctor goes, no, food has no impact. Yeah. And I said, wow, I will make sure no one I know ever comes to see you, because that's insanity. And so fast forward, now I'm mid-40s in the middle of perimenopause, and I've been very deliberate about who I hire on the path, because oftentimes whether the doctor is not going to even discuss lifestyle with you, which I have a huge issue with, or secondarily, let's say they do. Let's say you have a great team in place. I have an amazing team for hormone replacement therapy and everything I'm doing. That actually still can fall just short of lifestyle interventions. And if you listen to this podcast, you know I'm obsessed with health. Even I need a health coach on board in different seasons of my life to help me execute on my health goals. Because sometimes, based on your commitments, I know my commitments, I have a book launch coming. I am on a racetrack. When I'm on racetracks like that, it's hard to also hold such space for my own health goals. And I get blood work back and I look at my reports and I go, wow, I've got work to do. Those are deficiencies. And if I don't think I can handle it, I automatically call a friend of mine who is a coach and I say, you know what? I need support. And her job is to text me, check in with me. I just landed from a flight yesterday. She goes, how are we doing? How's the plan this week? And I knew immediately, okay, I better execute on what we discussed, because that's a commitment to me. And here she is committed alongside me for my health goal to support me on that path. And so I would love for you to speak into that power of a health coach to hold space for us, hold accountability for us. Even in my case, I'm a practitioner, but remind me about the steps it takes to get to the end goal. In my case, I want to focus on leaky gut. That's our focus. And so I'm just curious how you look at that.
Yeah. So a health coach helps people go from where they are to where they want to be. Where are you now? Where do you want to be? And it is a process that is built on listening. And that is the critical difference between the coach approach and the doctor approach. So the traditional approach is to find out what's wrong with somebody and then to tell them how to fix it. And it's based on a premise that you're broken, there's something wrong with you, and you need to be fixed. Whereas a health coach turns it around and asks the right questions. First and foremost, what's strong with you? It's a different orientation. The idea that you have inherent strengths that you can use, the idea that your mind, your thoughts, your emotions are really powerful and you have control. You can change those. You can engineer them differently so that they will have profound impact at a cellular level, because they're either inflammatory or anti-inflammatory. So they offer this opportunity for you to be heard and they ask the right questions that are going to lead to an aha moment. What might that look like? Well, questions like, what do you want your health for? What matters most to you? And then people get into a dreamy state. It's called a positive emotional attractor, where they're thinking about the future. Well, I want to have enough energy as I get older. I want to avoid being a burden on anyone. I want to be independent as long as possible. I want to be able to get down on the floor and play with my grandkids. I don't want to have to be in assisted living, for example. Yeah. And that then leads to other questions. Well, where would you be willing to start? And they'll tell you. And so often they've been given a treatment plan, whether it's from a functional medicine doctor or from their conventional doctor. And they can say, well, I got this plan from my nutritionist, my functional medicine doctor. Oh, and it has tons of supplements. And I don't know if I can afford that. I don't know if I'm ready to do all this right now. So they'll be really honest. And I want to mention this because I think it's really important. And that is, we know that people underreport to their doctors or their nutritionists. They will fill out forms and they won't check things that they're really going on because they're embarrassed, they're shameful, they want to look good for many reasons. They are not reporting everything, but they see the coach as their peer. And that's one of the reasons why, because I'll have a lot of doctors come to me and they'll say, oh, I want to hire a coach, but they have to, in my job description, I have to say that they need to be a nutritionist first and then a health coach. And I always present this example to them because those who are trained as experts tend to, in other words, they're going to have that same pattern. But, oh, they know this person is a nutritionist. So I'm going to not tell them that I ate a whole bag of Oreos last night.
Right.
So, but if a coach, they're seeing a coach, if you're a coach first, it doesn't matter your training, because what you are doing is you are with that person and it's more peer to peer. And so they're feeling very comfortable, that they can be 100% honest. And I'm not saying that we have a lot of coaches who do have a nutrition background or a MD in their background, or they've been a nurse before. But when they are a coach, it's critical that they are coaching. And they're using that coach approach, which means it's client-centered. It comes directly from that individual. And that is what's so, so key. It's the questioning. People are feeling heard when they're being coached.
I agree with you. And there's two things there. One, I've had this experience myself because I'm in a program where I hired Dr. Amy Horniman for my HRT. I love her and I respect her and I consider her a colleague. So when she gave guidance, I was like, absolutely, absolutely, I will just listen. But then when the health coach called, I was like, I'm not really comfortable. I'm so organic. I don't know. And so I needed a level of coaching with an equal where I could say, can we start lighter? Can we start with creams? I don't know. I need to ease in. And she and I have had this really honest, open relationship. We still do. We're all text her. I'm like, I want to try this other thing first. She goes, don't worry. We'll baby step in. Yeah. I know it's HRT. I know you have a lot of opinions about anything that's not an organic Ayurvedic botanical. It's okay. Yeah. And I love that, because otherwise non-compliance is usually the behavior. I'm just not going to do it. Right. A lot of times I buy supplements, and if I don't understand them, they just sit there in boxes waiting for even I to understand them. And I'm in the supplement world. Yeah. So I think that's actually a huge piece to the health coach partnered with the practitioner, because a practitioner can prescribe and make big recommendations. I've gone to functional medicine for years. The lists are long of what I'm supposed to do. But the mindset it takes to actually fully agree so that I am compliant takes someone else. And so if the functional medicine doc doesn't have a health coach on board, the level of compliance that I will have and the level of execution that I will have, and thus my longevity with the practice, is fully affected. I've left functional medicine practices because I'm like, well, it didn't work. Yeah. And then the question is, well, did it work or did you not do the work? Yeah. Which one is it? And that's where I think a health coach can have such a powerful support, because there's so much in the mind, like you just said, around our health. And if we're not in complete alignment and agreement, these are pretty big protocols we're signing up to do.
Yeah. I saw this when I worked as a health psychologist a lot. And again, I was using the coach approach before it was even a thing. And I was getting a lot of referrals from medical doctors in a community that mostly seniors, and they really saw that doctor as the authority figure. So they were not reporting that even with medication compliance, that they were getting side effects or things that they would be experiencing, things that they would be embarrassed to tell the doctor, or if they saw in functional medicine, I've seen many people not say they didn't follow through because it's too expensive. They didn't buy the supplements, or they substituted a brand that was a discount brand at like Costco,
Right.
as opposed to the ones the doctor recommended. But they're embarrassed to tell the doctor. And there's also the cultural differences. I think, I talk a lot in the school, I teach the psychology of eating, and it's always been an area that's fascinated me. And we eat something, it's based on our actually it's gender, our family, our friends, and particularly our culture, where we came from. There are certain foods that are foreign to us. We're just not going to be attracted, whereas others, because of our culture, it's natural. We want them. But yet then you can go to a nutritionist and they say, oh, you can't eat that.
Right.
Dr. Shilpa Saxena talks a lot about that, who's a functional medicine doctor, and she has health coaches in her practice. And she said, well, yeah, I mean, she has to be, it's really requires a lot of sensitivity to be aware. And they're going to be embarrassed or afraid to tell someone that they're just not going to do it because it doesn't fit with their values, with their culture.
Correct. And that can be a huge struggle. I'm vegetarian, and I've had many practitioners say to me, for the level of health you're seeking and the level of deficiencies you're running, please eat meat. And I have actually tried many times, and I have failed so badly because it's been 45 years of not putting meat in my mouth and trying to deal with this texture, taste, and experience. And there's even psychological, religious value issues there around. I have an identity tied to vegetarianism, and I've been trying to break it, and it's tough. And so my recent health coach friend who I hired again, she said, you know what? Here's what we're going to do. You are a vegetarian, and we're going to even follow your Ayurvedic rules. Mm-hmm. And then I think we're going to win, because if it's going to constantly go against your values, you're going to have a hard time complying. It makes total sense, but nobody's taking the time to ask you, does this fit your dosha?
That's right.
Does this fit your belief system of circadian eating? And I thought, gosh, thank you for listening. Yeah. Thank you for understanding that I'm values first, nutrient deficiencies second, health goals third. Honestly, it's hard to define even that order, but if something goes against your being and your values, how would you comply?
Exactly. The stress that you would experience eating meat would do more damage than to your nutritional status.
It has been like that. Yeah, it's not easy, but I love that in the health coaching world, there's this idea of to me, it's a group of people who are so passionate about health and so passionate about change. And how can we find the right, I think of it as leverage points with my clients, but how do you find the right mindset approach with the person in front of you for them to just agree to make the changes? And so recently with my health coach, she said, treat your body like an athlete. This is your commitment to self. And so that really landed for me because I have a commitment to self. So today during my lunch break, I was about to run back up and I thought, nope, you need to take your supplements. Those are non-negotiable. Wait, you need to hydrate with your aminos. Non-negotiable. Sorry. These are your commitments to self. And so that's where I think health coaching is so incredible and why we need to, across the board in medicine, support the idea of health coaching, because it's the perfect support to any medical or functional medicine, or truly, even in my opinion, Eastern holistic integrative practices. It's the perfect support alongside to help with all the other pieces that are needed to execute and get the results we want.
Yeah. And the good news is that, it's a question I'm often asked, well, is Is it affordable? Yes, it is affordable. And there are many practices that accept Medicare, for example, and they have a visit that's called a chronic care management visit. So if that practice has a health coach, that health coach could do that visit. And then the practice will bill insurance because that is something that is allowed under Medicare. If it is the private insurance, there are health and intervention codes, health and behavioral codes that can also be used. So there are practices that are getting reimbursed. And another way, if it's a cash base, would be through groups. Groups are very affordable for most people. And that is where the community becomes the medicine. And health coaches, we teach our coaches how to run groups, how to be the facilitator. And that's so powerful because people are increasingly lonely or disconnected, and they thrive when they are in a group.
Absolutely. And, when you were speaking earlier, I thought of the aging population. We talked about neurocognitive, Dale Bredesen, who teaches on reversing Alzheimer's and these topics. It's hard oftentimes for my generation to try to be a health coach to our parents. I've taken my mom many times to different detox centers like Hippocrates Health Institute for 3 weeks. I'm like, we need to reverse her diabetes. And they all look at her and they're like, we're local and we know your daughter. You could just listen to her. And she's like, I'm not listening to my kid. I'm here. Let's go. Let's do this.
Yeah.
And so it's not our job to sit there and lecture. And I shouldn't say it that way. For many of us, it's difficult to lecture and try to put a health plan onto our parents. For me, I always try and I always fail because I'm like, why can't everyone listen? We have to win at inflammation, movement, weightlifting, sleep, circadian, supplements. And I can tell you, everyone who's elder to me doesn't want to listen to me if they're related to me. Thankfully, all the rest of the millions out there do listen and care about listening about Ayurveda. So I think this could be really powerful in that way too, is if you're watching your parent in front of you have inflammatory-based diseases or health struggles, to find a health coach for them could help start to reverse all those lifestyle diseases and conditions that they're struggling with. And thus, that's an investment in your own future and relationship with your own parent.
Yeah. Oh, yeah. And we have the research to back it up, whether it's heart disease, whether it's type 2 diabetes reversal, COPD, chronic obstructive pulmonary disease. There's randomized controlled trials where somebody got the usual treatment and maybe a pamphlet about lifestyle. Those who worked with a health coach, and the group that worked with a health coach did much better on their biomarkers. Hypertension is one. Cancer, it improves quality of life, meaning of life. Cognitive decline, the same thing. We've seen great results. So Parkinson's is another one, and mental health. We talked about the shortage and looming shortage getting worse of primary care doctors. Well, the mental health professional, that's shortages on steroids. We have older therapists retiring. People are not going into these professions. There's a high burnout rate. And what are they offering? The psychiatry is just offering medication. Psychotherapy is all about, well, you have trauma, you're damaged, there's something wrong with you. And it is not focused on a very empowering problem solving, like you can go out for a walk and that's more effective than any antidepressant. So let's walk together. I used to do that.
Yeah.
Because then people would feel better. We'd go out for walks. We'd do nature walks together. And so food is definitely tied to mood, to anxiety reduction, and helping people as a coach. They're not therapists. And so I'm not talking about people with severe mental health conditions like schizophrenia, for example, although even there, they can help people feel empowered to take charge of their health and great changes through lifestyle change with the support of mental health professionals. But for somebody who is just saying, I'm a little down, I'm feeling just sad all the time and just can't get with, rather than giving a diagnosis and then having them have a sense of, well, I just have a chemical imbalance and I've just, that there's something wrong with me and I'm a victim of depression, but that working with a coach normalizes these feelings and gives them hope that you can change. And it is very, very possible to provide that support so that you can make inroads even in mental health, because we have long waits to see a mental health professional, and some people aren't even seen at all. And support for the families, too, I should mention that. And caretakers is another big, big role for health coaches.
Sure. And you mentioned the philosophy being you are whole. And in Ayurveda, we believe that the whole goal is let's bring body, mind, and spirit into alignment. If you have an imbalance, if you are manifesting currently a disease or something out of the body, where's the imbalance? Let's just get to that root cause and let's bring things into alignment. And so I love that in the health coaching profession, in the school you've created, this platform, you're teaching you're whole. We're just helping you bring everything back into that alignment.
Absolutely.
And everything back into wholeness, because it's just an imbalance from wholeness. It's not you are broken, you have this disease, we have to reverse this disease, and then I'm sure there's 18 others we have to fix, and we have to fix you. And you're going to be on these medications for life, and that just is what it is. It's a much more holistic vantage point into what's possible. And I do think nowadays, so many of us go to personal development conferences. We have business coaches or life coaches. I've had those in the past, and I love them. But a lot of times what I found interesting is when you follow people in personal development, I've gone to Tony Robbins conferences and different conferences like that. It's always, here's personal development. Let's let go of the past. Let's focus on the future and the present. And then let's talk about your health. Because if you don't put your health into alignment, it doesn't matter what I say, because you're not going to build the energy and that total energy output you're going to need to fulfill your dreams. So part of what I hear you saying is your health coach should be your first partnership in many ways, because if we can get health in the right track, health in the right pathway, then all of a sudden, all those other pieces can come into place as well. I think people forget that. They think of business coaches. And a lot of times when I talk about health coaches with my friends, they're like, I know how to lose weight. I know everything. I'm just not doing it. And I look at them like, there's a reason you're not doing it.
Right.
I am not your health coach. You're not listening to me because you're my friend. And thus, can I give you someone so you'll understand that the mindset has to shift? My job as a practitioner oftentimes is to I call it addiction. I want to get you addicted to feeling so good that you will want to exercise, eat well, live the Ayurveda lifestyle, those pieces. But can you speak into that idea of health coach first, other things second, because we're building energy channels inside of us?
That's right, because it's not an information deficit, the example you gave. You can go online, you can get all of the information.
Yeah,
but
ChatGPT will tell you.
Absolutely.
Doesn't mean you'll do it.
Because it's doing it. We have an intention behavior gap. We may have good intentions to change. We're there. But at the end of the day, we don't follow through. Life intervenes. That's where health coaches are critical. So they're supporting behavior change. And they're also helping you sort out what's out there, because often people will hear something, they'll go on social media, they'll see an influencer, and, I'm going to follow that. Oh, that's how to, your example, I know how to lose weight. Well, maybe you think you know, but that's not the right thing for you. And so health coaches can be your guide, and they can help you to have this power that's called being your own medical detective. Because in health coach first, increasingly, it would be your doctor is called in as the consultant, because we're seeing a major shift with wearables as one. For example, we can track our own data. Now, I wear a continuous glucose monitor, so I can see in real time what my blood sugar is like. That was unheard of years ago. You'd have to go to the doctor, and what do you get? Once a year, you get that blood. And you realize, well, no, it's changing all the time. So you have that data. We have data on how many steps we're getting. Our VO2 max you can get from your phone. Increasingly, we have rings. I wear an Aura ring. I can track my sleep. So you have that data. And we're also seeing a revolution in blood testing, where what used to be 100% controlled, you had to get to your doctor for everything. Well, that's not true anymore.
True.
You can get tests, increasingly AI driven. I just heard of a company called Nucleus, where you can get your entire genome tested. You can get, and AI is showing you, oh, here's your risk for this, this, and this. Here's what you can do about it. Well, this is great, but it can also be overwhelming. What do you do with all this data? What if you get an alarming result and now you're freaking out and you're misinterpreting? So health coaches can talk you off a ledge. They can help you see what's real, and they can use this data to help you make informed decisions, to say, well, yeah, here's one that maybe this direct-to-consumer test could be off. So, what are your thoughts about getting this from your doctor, who might be the expert in this area? So we're not saying no doctors and all doctors bad. We're saying that the health coach will help you use the medical system in a way that best serves your needs.
Absolutely. And I love you shared it in that way, because to me, it's always about partnership. I love the surgeons who I've worked with for my body. I had fibroid surgery. That doctor had amazing bedside manner. So really what you're saying is, look, you're going to go to great doctors. You're going to get great answers, but you might also need the lifestyle coach, or it's not also, you need the lifestyle coach in place in your life when you want to achieve the health goals around lifestyle changes, mindset shifts. And I really look at it as optimization.
Yes.
So yes, I could call a coach and say, hey, I need to lose 10 pounds. This is too hard. I'm not winning. I could call a coach to say, hey, my blood work came back as crap and I have work to do. That's sometimes why I call one. Or it could be that third piece. A lot of times what I'm saying is I need energy and brain optimization. I need someone to partner with me because this is a big project. Yeah. And if left to my own devices, I'll buy 800 supplements and 50 devices. So I almost need like a colleague who's on that road with me, alongside me, who's supporting me, because it's in this day and age, there's so much coming at us. It helps to have someone, again, like you said, who's supporting you in the mindset shifts and the thinking around what do we need to take off our plate in life. Maybe that's really what we need.
That's right.
More than buying one more thing or adding one more thing on the pile. I find health coaching is always like, hey, where are we at, and where can we simplify and clean up some processes here to get you to feel where you want to be with everything you're doing.
Yeah, that's critical.
Yeah. Well, Sandra, I have loved talking to you today. I know I could talk to you all day because we are very aligned in our thinking here. Is there anything else from your wonderful book, Your Health Coach Will See You Now, that we haven't talked about that you want to share with the audience before we wrap?
I think that if what you've been hearing inspires you to get a coach, but also to train to be a coach, this is a profession that is pure joy, because you are entering into a relationship with somebody that is heart-centered and you are personally transformed. Your communication skills improve, your ability to be in relationships improves greatly. So it's very satisfying, and we need you. We need millions of health coaches to help people get healthier all over the world, I should say. This is not just in the United States, but this is a worldwide phenomenon.
Amazing. Thank you. Well, where can everyone find you, Sandra, and the FMCA program?
They can go to functionalmedicinecoaching.org. On Instagram, Facebook, it is Functional Med Coach. And personally, on Instagram, I am Dr. Sandy, DrSandi. So reach out. We'd love to connect with you.
Nice. Well, thank you so much for coming on to the podcast today. I love sharing with my audience all the different approaches we can take towards our health. We are all bio-individual, having our own journey on this planet in this moment, and having the support we need to live out our highest and best self is my goal for each and every one of us. So thank you for joining me today on the Fusionary Health Podcast. I can't wait to see you next week. And for more info on this podcast, you can go to shivanigupta.com and learn more about my free challenges and free tools and everything I have for you. Thank you very much, and see you next week. Thanks for joining me for this episode. Check out our sponsor, Fusionary Formulas, the potent turmeric supplement used by doctors around the U.S. for patients with pain and inflammation. www.fusionaryformulas.com. I'm your host, Dr. Shivani Gupta. For more, visit shivanigupta.com. Subscribe to this podcast in Spotify or Apple Podcasts. Click the follow button or subscribe in any of the apps that you use. That's all I've got for you on the Fusionary Health Podcast this week. You have the power to transform your health and achieve vibrant health starting today.